Thank you all for joining us today for this online health series on shingles featuring Dr. William Craig of Renown Medical Group. Dr. Craig received his medical degree from Harvard Medical School in Boston and completed a residency at UCLA Harbor General in Los Angeles. He has a fellowship in geriatrics from Rush University in Chicago. Today's presentation is approximately 1 hour. If you have questions during today's seminar, please submit them using the chat function on the left-hand side of your screen, and Dr. Craig will be addressing your questions at the end. And now I'd like to turn it over to Dr. Craig.
Hello, everyone. It's a pleasure to be with you today to talk about this very important condition. I've put together an agenda that was based upon the questions that people often ask in the clinic, and I hope that it covers some of the basics of the disease that you'd be interested to know. And then at the end, if there are additional questions, we will be able to cover those as well. Here's the agenda. First of all, to talk about this virus, which is called the varicella-zoster virus, the VZV. And the question that is of most interest to everyone is whether or not this virus causes one disease or two diseases. And I think that we'll be able to clarify the way in which a single virus causes two different clinical manifestations. The third thing that most everyone wants to know is who is at risk, and how does that risk profile change over time. We'll talk about the protection that is available to prevent the disease. We'll talk about the treatment that is available to treat the disease, and then, as I said, we'll have time for questions. So let's look at the first meaty slide here. You see the title, what is the varicella-zoster virus? Well, it is one of the herpes virus group, and it is known to cause only human infection. So I'm sure people have heard about bird flu, where there's a virus that crosses over between birds and people, and also between swine and people. So we have the swine flu. This is a virus that only exists in people. It is of worldwide distribution, so it's not limited to any one of the continents. It's found everywhere. And the virus, the single virus, the VZV virus, causes two diseases, chickenpox and shingles. It's been about 100 years since people first began to suspect that the two diseases were related. Before that, there was no understanding that one agent could be responsible for both diseases. It was in 1965 that there was the first formal hypothesis that a reactivation of the VZV virus was the cause of shingles. And that was proven when finally our viral laboratory techniques were sufficient that we could identify the virus from one patient that had chickenpox and then later developed the shingles. And it turned out that the viruses that were collected from that one person at two different times were proven to be the same. And that's when we knew that there was one virus responsible for two diseases, even though we weren't sure about the mechanism. And we'll talk more about that as we go along. This clever virus causes chickenpox in its first manifestation in people. And most people know that pox is this little vesicle that develops on the skin and then scabs over, and there may be one or many of them. But that's a primary disease that has been long known to be a disease of childhood primarily. It can occur in adults as well if they have not been exposed, and it can occur to people who have been exposed but avoided the disease. What happens apparently is that the virus is initially acquired through the respiratory tract, and it travels around in the body, in the blood, and then manifests itself on the skin in these forms of the pox. Then what apparently happens is that the virus then infects the nerve endings from some particular nerve in the body and travels up from the skin source up into the vertebral ganglion, which is up near the spinal cord. Then, some years later, that virus comes back down that nerve and manifests itself on the skin as the shingles, which is, in fact, a reactivation phenomenon. So, what happens when a person gets the shingles? Initially, there is pain, and it can vary between mild to severe. It can be associated with some itching, but most commonly, it's a very sharp burning pain. And the interesting thing clinically is that the pain can occur before there's anything you can see. That brings people sometimes to the emergency room. If the area of involvement is over the gallbladder, then frequently people will think that they may be having a gallbladder attack. It could happen over on the left side of the chest and could confuse someone about whether or not they were having a heart attack. So it is very difficult to make the diagnosis in the first day or two. But if you wait, and sometimes this occurs at home because the manifestations are not severe. Sometimes it occurs that people are seen in a clinic or in the emergency room. And then what happens is there's an outbreak of blisters. It can be one small area, it can be an extensive area, and it occurs in the distribution of one cutaneous nerve, one nerve that innervates a part of the skin. Because the trunk is such a large part of the body, the most common manifestations are somewhere between the shoulders and the hips. That's the area that are primarily involved, just because that statistically is the large skin area. But it can occur anywhere in the body. It can occur in the scalp. It can occur in the face and sometimes involve the eye. It can occur in an extremity. And those blisters form. They're vesicles. They have fluid in them. They look like the pox. And then after this is untreated, then after a few days, the blisters will break and the area will crust over. Those blisters do contain the virus itself. So that material from the zoster blisters can infect someone who has not ever been exposed to chickenpox, and the manifestation in the person who was in contact would be chickenpox. Today, of course, most children are immunized against the disease, but people who are not immunized can contract the chickenpox as the result of exposure to the shingles outbreak. The most common unfortunate complication of shingles is the development of pain in the area of the outbreak that doesn't go away. And that pain may last for a few weeks, it may last for a few months, and in some unfortunate cases, it can last for years. And we'll come back to this when we discuss treatment, because we do think that treating people with the appropriate medications reduces the incidence of the what we call the post-herpetic neuralgia. So after the herpes virus has arrested, the skin will go back to looking normal, or there may be some scarring, and we're talking about the prolonged pain. So that's a feared complication and a reason that many people will seek treatment to prevent the illness. It is true that in uncommon cases, we're talking about only a few % of people who develop shingles, there will be outbreaks of the virus in other parts of the body. You see there on your screen HZ, herpes zoster, opthal, that stands for involvement in the eye. ARN would be involvement in the kidney. HZ, oticus, would be involvement in the ear, and in fact the central nervous system can be involved as well. So there really is the possibility for an outbreak in any part of the body, but most commonly what we see is skin manifestations. Who is at risk? It's probably of no surprise that a very large number of people develop this disease. There are more than 1 million cases a year in the United States. And if you consider the lifetime risk for an individual, 1/3 of the population will have the disease sometime in their lifetime. Cases have been increasing in recent years for reasons that we are not certain of. We see more cases now. I guess in my clinic I'm seeing about 1 case every week or every other week. And if I think back to earlier in my clinical experience, I might have seen a case once every couple of months. So I think the people who track incidence of diseases are charting this. And one of the things that happens is that with age, the risk of developing the disease, the shingles, increases. You see under risk factors there, immunosenescence, meaning the gradual decline in the immune system effectiveness due to aging. And that's a well-known phenomenon and probably accounts for a good portion of the fact that as people age beyond the age of 50, 60, 70, and 80, their likelihood of developing zoster increases. So that when we're younger, we don't have this recrudescence of the disease. But as we get older, for one reason or another, not well understood, the chance of having the shingles increases. Secondly, there, under risk factors, a disease-associated immunocompromise. That means diseases, for instance, like rheumatoid arthritis or HIV, conditions where the body is itself involved somehow in an autoimmune phenomenon, and people with those specific conditions are more likely to have outbreaks. The third subpoint there refers to the fact that we treat people with powerful drugs that in their own right cause suppression of the immune system. And so people who are on drugs that are known to do that are often warned by their physician that they need to be protected by vaccination. What protection is available to prevent the disease? Well, varicella vaccine is used widely now to protect children against chickenpox. And the vaccine that is used is an attenuated virus, which means that the virus does not cause the disease. It has been altered so that it causes the body to develop antibodies against it, but not to cause the disease itself. The recommendation from the major organization that looks at all the statistical data on population illness has been very consistent for many years, and that is that people should be immunized. It's a two-step process, first at age 1 and secondly at age 4 to 6. You can see there in that first bullet point that the strength of the vaccine is about 1,300 viral units per dose. And when you look at the protection that is now available for adults, you see it is a large multiple of that number. It takes more of those virus particles to protect the adult than was necessary to protect against the disease in the first place. The recommendations, there are two recommendations out there. One is really just FDA, Federal Drug Administration, approval of the vaccine, and it's approved for people who are 50 years old or older, and it's a one-dose vaccine, unlike the childhood vaccine, which is 2 doses. There is also the Advisory Committee on Immunization Practices, and they are recommending that people who are 60 years old with or without a history of shingles have the vaccine, and again, 1 dose. So you have an option, 50 years old, it's approved for that use, and 60 years old is fine. It's just that between 50 and 60, the incidence doesn't increase very significantly, although it's more likely to occur to people who are 60 than 50. But by the time you get beyond 60, 70 years old, 80 years old, the incidence of disease is much greater. So that's what leads to that. Depends on where you set the threshold, basically. There are times that the vaccine is not indicated, and the first one there on the slide is that when you have the disease, at any point in which you have an active case of shingles, the vaccine is not effective. And it is also not recommended for pregnant women because it can cause damage in the fetus. It's not recommended for people who have a definite history of anaphylaxis to gelatin or neomycin, because those are both things that are involved in the development of the vaccine. And it's not recommended for people who have acquired immunodeficiency. It is something that is not given at the same time as the Pneumovax, which is another one of the adult vaccines that's quite effective in keeping people from developing the most common type of pneumonia. It's a good idea that these two things be given at separate visits. If a person has the disease, there are effective ways to shorten the course and decrease the chance of developing that post-herpetic neuralgia, or that prolonged pain after the illness. There you can see the names of 3 different antiviral agents there on the slide. Any of those are quite effective in reducing the length of time and the complications. Sometimes, depending upon the severity of the symptoms, corticosteroids are given, again, in the hopes of reducing the chance that someone will have prolonged pain. And for not an insignificant number of people, the pain is severe enough that some type of pain medication is necessary. Clearly, the best option is to have prevention, and that means getting the vaccine before there's any sign of illness. And that got us through the discussion rather rapidly. We have plenty of time for questions.
We have a few minutes left in our program today, actually quite a bit. So if you have questions about shingles, please submit them using the chat function on the left-hand side of your screen. And we have a few questions that came in while you were talking, Dr. Craig. So if I got the chickenpox vaccine, what are my chances of getting shingles?
A good question. If you got the vaccine and it protected you against the disease, then clearly you should not develop shingles because you will not have been infected by the virus. The vaccine that you're given is not the same thing as having the illness. So the answer, in my view, is that that's not going to happen. If you are vaccinated successfully and never experience the chickenpox, you will not develop shingles later in life.
Okay.
Good question.
Yeah, it is a good question. Okay, this person says, I had the shingles vaccine many years ago. Do I need a booster?
Not as far as we know is the answer to that. Both of the groups that certify the safety of the vaccine and that recommend what the immunization practices should be agree that a single dose is necessary.
Okay. What is the treatment for ongoing pain due to shingles, like pain that, you said, months later?
That's a good question, and one that is very much on the minds of people who have experienced it, because it can be debilitating, prolonged, and we do have ways of treating it. Basically, there are a number. It's primarily a nerve pain, and therefore some of the medications that are used for chronic nerve pain are helpful. Unfortunately, that's not always sufficient, and sometimes people need to be on chronic pain medication as well as on the medication to control nerve pain. It can be a very vexing problem and one that requires usually the attention of people who deal in that area specifically.
Okay. If you get the shingles in your eye or in your ear, can that impact your sight or hearing long term?
Answer, yes. And anyone who has shingles in the eye itself needs to be treated by an ophthalmologist. Sometimes people have the manifestation on the forehead and it doesn't get into the eye, and that's one type of treatment, but specifically in the eye requires ophthalmologic treatment to make sure that the sight is preserved. And the same thing is true in the ear, although I'm not sure that we have as effective a treatment for it, but it can affect hearing long term.
Okay. If I've had the shingles, can I get it again?
And the answer is yes, but it's uncommon. There are things that masquerade as shingles or look similar to it, and that would be lesions that come from other herpes viruses that can be mistaken for the shingles virus. But occasionally, usually in the same area as the original outbreak, people will develop a secondary lesion. It is uncommon. The recommendation, which you probably picked up in the slides, that the immunization is available to people who have had shingles in the past, And again, it's a single dose, and so if you'd had shingles and you want to decrease your chances even further of having a recurrence, that immunization is viewed as safe and effective for that purpose. I don't think I mentioned or highlighted the fact that the vaccine operates to reduce the incidence of shingles, not to zero, but by about half. But it also reduces the incidence of the post-shingles outbreak pain by about 3/4. So it's both useful to reduce the incidence in the first place and as well to reduce the incidence of the complications.
This person says that they heard the shingles vaccine was very painful. Is that normal?
It's not our experience in the clinic, and the published studies that have examined this in large numbers of people indicate that a little minor soreness in the injection site is an occasional event, but I have not heard anyone say that they were significantly impaired or inconvenienced by the immunization itself. Usually one of the mild pain medications, Tylenol or an aspirin type drug, is sufficient to reduce those symptoms.
Okay. This person says they got the chickenpox vaccine as an adult. Do they need more than one dose? Because you mentioned that children need 2 doses.
And I believe that the Immunization Practices Committee, if you're getting it for the first time, would recommend 2 doses, just like the childhood dose. In other words, the first time you begin to develop immunity, but you wait a period of time and then have a second dose in order to create the kind of antibody level that leads to protection.
How long does the shingles rash last?
In general, as with the chickenpox, it's about a 7 to 10 day period during which the blisters develop, break, and crust over. That doesn't mean that all of the symptoms signs on the skin go away. There often is redness and pock marks and things that are more prolonged, but the actual lifespan of the blisters themselves is usually within 7 to 10 days. They dry up and then subsequently fall off. If there's no secondary bacterial infection, the skin returns usually pretty much to normal, although there may be some hyperpigmentation present.
Can the shingles vaccine cause chickenpox or the shingles?
The shingles vaccine does not cause the disease, either one. It doesn't cause chickenpox and it doesn't cause the shingles because it is attenuated, meaning it's not a fully functional live virus. So it doesn't cause disease. What it does is deliver an antigen or a copy of the virus to the body so that the body can prepare antibodies against it. So it's part of the protective mechanism of the body to develop antibodies so that the next time you see that virus, you will not become infected by it. And it's much the same principle as the influenza vaccine.
Okay. Well, this concludes our online health series. On shingles, a very big thank you to Dr. Craig for sharing his knowledge and time with us today. For more information about shingles, speak with your doctor. If you need a doctor, visit renown.org/findadoc or call 775-982-5000. Don't forget to visit our health blog at renownhealthblog.org for a special blog post from Dr. Craig. A recording of today's presentation will be available at renown.org/online health series. As always, we wish you continued good health.